Apologize to the member for Kingston and the Islands for making him wait. I recognize him with the next question.
Mr. Speaker, in late 2021, COVID-19 cases skyrocketed in the Kingston area with the Omicron variant. An enterprising local doctor, Elaine Ma, ran a drive-through mass vaccination clinic. Community members, like my own daughter, volunteered to help. Thousands were quickly inoculated during a critical couple of days. That's why I was shocked when I learned that OHIP asked Dr. Ma to pay back its $600,000 reimbursement. Why? OHIP said because shots were given in the St. Lawrence College parking lot, not in her office. Mr. Speaker, this is a follow-up to a letter to the Minister's office that I sent several months ago. Does our government have the backs of doctors who think out of the box and take the initiative to protect us during health emergencies? Would the Minister intervene and override OHIP's action and offer a fair solution?
The Government House Leader.
Thank you very much, Mr. Speaker. Of course, we'll look into that. I know in my own riding, we had a drive-through vaccination clinic which worked very well. It really the COVID pandemic really highlighted the failure of the previous Liberal government to do anything about health care. Right. The reason we had some of the lockdowns, the longest lockdowns in North America, is because the Liberals left us with such a crumbling, decaying healthcare system. And you know who supported them every step of the way? Was the NDP. So in 2011, the Liberals cut the healthcare budget when the federal government increased it by 6%. You know who supported them? The NDP. In 2012, the Liberals cut funding to small hospitals in rural areas across the province of Ontario. You know who supported them? The NDP. In 2013, the Liberals cut medical school admissions. You know who supported them? The NDP. On every measure, you support them. And that's
the member will take his seat. Supplementary question.
Mr. Speaker, this is not really a partisan question. OHIP asked Dr. Ma to repay about $600,000 in reimbursement for costs incurred. $600,000 is about the cost for one COVID patient to stay a couple of months in the ICU. So that drive-through clinic was really a really cheap way to vaccinate thousands and prevent many additional COVID-19 patients going to the ICU. Dr. Ma followed the rules, the steps to qualify her mass clinic under the prescribed GQ&H billing codes and OMA billing practices for mass clinics. She is being punished for no good reason. The Minister of Health has the power to conduct a post-payment review. Will she intervene today? Will she set a healthy precedent so that in our next public health emergencies, doctors who take the initiative to protect us in good faith can count on support from the system?
Thank you to the member for Kingston and the Islands. Order. Government House Leader.
In my own home community, Dr. Pearl Yang did the exact.
The member for Ottawa South will come to order. The member for Orleans will come to order. The member for Brampton North will come to order. Apologize to the Government House Leader.
Dr. Pearl Yang in Stouffville did the exact same thing, Mr. Speaker, so we'll look into that. But it's really telling that the member for Ottawa South is yelling, right? Because while he was here and he supported that previous Liberal government that year after year after year cut health care funding, supported by the NDP, this is a member who was an absolute failure when it came to delivering for his own community. You know who's rebuilding CHEO, the Children's Hospital of Eastern Ontario? It is this government. Well, that member sat there and supported a government that built no long-term care homes in his own community. In his own community is this government, which is building more long-term care homes in his own riding than they built province-wide.
Order.